Good morning. My name is Mackenzie Milbrandt, and this is my communication observation video report. Um, in my video report, I'll be going through an effective communication scenario and a non-effective communication scenario. I will role play them both. I will be acting as Dr. Johnson, and my little gnome guy here will be my patient, Mr. Smith. I'm going to start off with my effective communication scenario, and I will role play that scenario. Good morning, Mr. Smith. I'm glad to see you made it to your appointment this morning. I am Dr. Johnson, and I will be the one doing your filling today. My dental assistant, Bree, said that you stated that there are no recent changes in your medical history. Is that correct? Okay, perfect. How was your weekend this weekend? Oh, good. You spent time with your grandkids. Um, so today we are going to be doing a filling on that upper right side. I know that your chief complaint, your main concern is that little dark spot on the tooth. Is that still the case? Oh, okay. Well, that little dark spot will be gone after your filling today. I know that you're a little bit nervous about the appointment, which is completely normal. Everyone has some dental anxiety, so I completely understand that. If at any point in time during treatment today you need a little break, we can switch up and give you one. Or if you have any questions, feel free to just raise your hand and we can stop treatment and sit you up or anything like that. I do know that last time I worked really well to talk you through each procedure, so as we take out the cavity and then each little step in the filling, I will explain things as we go. And if you have any questions or need any help with communication, you just stop and let us know. Okay, let me see here. I'm going to finish going through your medical history and then we'll lean you back and get you started. Do you have any other questions today about anything, Mr. Smith? Nope. Oh, you're feeling good and ready. That sounds great. Let's lean you back. So now I will evaluate that effective communication scenario utilizing the PACT tool. So the first tool in the PACT tool is exhibits a connection. And in my effective communication scenario role play there, the provider, Dr. Johnson, did a really good job of creating a rapport with the patient. So when she walked into the room, she addressed him as Mr. Smith. Dr. Johnson introduced herself. She offered a warm greeting, asked the patient what they were doing over the weekend, kind of settle those nerves and ease the patient's concerns. She acknowledged that she knows information about the patient to make the patient feel comfortable. Talked about, okay, we're going to do this filling on the upper right side like we discussed last time. She then verified and prioritized the patient's concerns. She repeated the patient's chief complaint that they had discussed about the black spot on that tooth on the upper right. And then they discussed that after the filling was completed that black spot would no longer be there, which should ease the patient's nerves. Like, ooh, okay, that was my chief complaint and it now should be gone and fixed. She planned the visit with the procedure or with the patient. She kind of let the patient know what to expect, that she would lead the patient back, and at each step she would kind of walk the patient through the procedure, helping the patient ease their dental anxiety and feel a little bit more at ease with all the steps that were going to happen throughout the procedure. She did a good job at using the PACT tool to demonstrate interest and empathy. She acknowledged the patient's emotions of, I understand that you are a little nervous about today's appointment, but we're here for you as providers and we understand being nervous and we can take a break at any time. And also helping walk the patient through the steps in the appointment does a good job at easing those patients' nerves and just letting them know that as providers we're here for them. So that communication was very successful. They also used the PACT tool to collaborate and educate. The skill used there was proposing a plan for what we were going to do today, that we had previously talked about it, but kind of letting the, sitting down and letting the patient know, okay, here's what we're going to do. I know we talked about it last time at your treatment planning appointment, but I'll reiterate it before we get started, and so the patient knows what's going to happen, there are no surprises, and feels comfortable about the treatment. Another tool used was good communication. The provider was confident, professional, organized, and those just really are key things for effective communication. Being organized and being professional and taking those few extra minutes when you sit down to be like, okay, here's what we're going to do today, and making the patient feel more comfortable. And at that point in time, the patient could express any concerns or any questions, and asking the patient, like the provider did, Mr. Smith, do you have any questions or concerns? That's a great way for the patient to be like, yes, before they get started. If you don't ask those, the patient doesn't have the opportunity to. So lastly, I am going to go over a non-effective communication scenario that I witnessed recently, which kind of the opposite of the effective communication scenario. Again, I'll use my gnome, Mr. Smith, and I will be Dr. Johnson. Good morning, Mr. Smith. All right, let's see here. Oh, we're doing a filling. You know what a filling is, right? Okay, yep, we're gonna lean you back and get you numb here, and we'll get started with that. So, although in that scenario, sometimes that is what it looks like when you walk into the dental office. It's short and sweet, and patients have been here a million times before. They've had 10 other fillings, and they know that I'm Dr. Johnson and exactly what's going to happen. But if this patient, Mr. Smith, has dental anxiety at all, he's going to be kind of stressed. You just rolled in. You didn't give, there was no connection or collaboration or communication at all. You leaned the patient back and you went to work. Things that weren't addressed, there was really no rapport created with the patient. The patient's concerns were not verified. The plan of the visit was not discussed. The patient's emotions weren't acknowledged. Mr. Smith has some good dental anxiety, so talking to him about it and letting him know that you know that he has dental anxiety is going to ease that anxiety right off the bat. Not saying anything about it, freaking him out, just laying him back right away. It's not going to make it easier at all. We didn't discuss the goals, and the purposes weren't discussed. Professionalism and communication were hugely lacking. The patient-centered communication tool is a great tool to determine what we're doing an amazing job at and what we're lacking as providers. I think that, like this scenario that I just demonstrated with poor communication skills, I feel that lack of time, lack of concern for the patient are the things that get in our way as dental, professionals. And so when I took a scenario that I had seen recently, it was just a rush day at the dental clinic, and the provider was rolling through her scenario, but at the same time you could tell that, oh my gosh, the patient was not feeling at ease or comfortable, and that's just not the experience you want your patients to have, and that's not the kind of provider you want to be. In that second scenario, even if the patient had told the dental assistant, oh, I'm taking these new meds now, the provider didn't take any time to ask the patient if there were any changes or any concerns or any conditions. So using that patient-centered communication tool this week has been a really cool thing to be like, oh, I do a great job at these and I am lacking at these. Refreshers like that help you take a step back and kind of think about what you can do better in the future, and it really helps when you watch other people's communication at being like, these are highs and these are lows. Thank you for watching my role-playing scenarios and for meeting Mr. Smith.